Good afternoon and welcome to another edition of Wonderful Wednesdays with Wendy. I'm your host, Wendy Botecki, the Parent Support Connector at Mission Empower. Mission Empower is a federally granted nonprofit, and we serve as a community parent resource center in Erie County. We are all about all the inclusion and about helping our families understand what their rights and responsibilities are in education and helping our families understand what programs and services are in Erie County that can help them out. And today I have Karen, which I'm not going to botch her last name, she's going to say it, from the Department of Health, and we're going to talk to her about what she does in the dental field. So good afternoon, Karen.
Good afternoon. My name is Karen Omniewski. Omniewski.
Omniewski.
Karen O is what everybody calls me. Karen O.
We're going to go with Miss Karen today because it's a lot easier on me. Okay. So explain to me what your job is with the Department of Health, because I've never heard of one of these before.
Okay. I'm a public health dental hygiene practitioner, which means that I do not have a dentist on site. So I only can do preventive things. I can take x-rays, I can do cleanings. We have done some sealants and obviously fluoride treatments. We see children from the time their first tooth until they're gone, all the way up. So there is no age limit here. And also it is, all our services, all my services are free. We don't ask for any financial information when they come in, unless we refer them to a dentist, and then sometimes they require it. But for our purposes, we don't care how much you make. It is really, we want to serve the underserved, the uninsured, and the underinsured. So that's our primary goal. That's what I do here.
That's fascinating. So how did your program begin? How did it come to be?
All right. Actually, I believe it was 6 years ago, a dental hygienist from the state of Washington moved to Erie. And she really was kind of disenchanted with the lack of public health services available to low-income families, low-income people. And so she designed and worked. Actually, she came to the director of the health department, who's Melissa Lyon, which you probably know because she's been on TV a lot now. And she presented this proposal to her. And interestingly enough, it's always been a passion of Melissa's. She's been an advocate for oral health in her whole public health career. So she was very excited to offer this program. And they worked for a year developing it. And Highmark Foundation granted them the first grant, which supplied a huge amount, well, huge is relative, but a large amount of money for the dental chair, the dental unit, and all the supplies that she needed to start the program. And again, initially, it was set up mostly for pregnant women and children because they were the ones that we found were at most need. We're considered a low-income dental shortage area, which means there's less than one dentist to 5,000 people, and particularly those that accept Medicaid. And so she set it up and it got started, and it's been going well since. This is my third year. So
how do you find your families? How do you get in connection with them? How do you contact them?
Well, we have a couple programs here at the health department. We have the Nurse Family Partnership, which I believe you already had a video about. There's also the, I think it's maternal child health. It used to be maternal child health, but it might be family child health now. So they do several referrals. I just had 2 in, children who are 1 year old, and the parent wants to come in. So we offer it again, age 1 or at the eruption of the first tooth. So when the Nurse Family Partners talk and the others talk to their families, they tell them about our program. If they're pregnant, they can also come to us during their pregnancy. Actually, they can come 4 times because most, even though we don't cover it, most insurance covers for a year. So it works out well. But that's where we get most of them, at least initially. Then we also get a number from the Immigrant and Refugee Center here in town. They refer an awful lot of people. There was a bit of a decline, obviously during COVID, and also when the Immigration and refugee, everything was shut down. We weren't allowing immigrants into the city. So we had a few lower of them, but I'm sure those numbers are going to go back up soon. So we get a lot of referrals from them as well. And honestly, just word of mouth. Initially, she definitely did some marketing. I wouldn't call it advertising because I don't really think we advertise, but we haven't done that again, especially not through COVID because we weren't equipped to see people at that time. So we really get it from most of those places and word of mouth. Some people heard it on advertisements 6 years ago and they still come every 6 months. So
that's a really, really good thing. So if I'm part of one of those organizations, or maybe a doctor or a friend tells me about you and I call up, what is the process from first phone call? I call you and I say, I need to come to the dentist. Help. Okay.
All right. The first thing is you wouldn't be talking to me. You'd be talking to the people at the front desk, which is 814-451-6700. And I'm just opening back up. So they'll usually take your name and number and I will call you back to schedule an appointment or call the person back to schedule an appointment. Once they come here, again, it's a little different with COVID regulations still, but I usually will contact them a couple days before and go over all the paperwork information that I will need for them to sign and fill out. You do have to fill out a complete medical history. You have to sign the HIPAA forms. Because I have to refer you to a dentist afterwards, I also have permission to do that. So there's another form for that. And then I have to tell you everything I'm going to do that day. If I'm going to take x-rays, do you agree to that? I'm going to clean your teeth. I explain what that cleaning involves, whether I'm going to do a fluoride treatment. That all has to be discussed, and then that has to be signed. And all of that, truthfully, probably takes, if you're English speaking, probably takes 15 to 20 minutes just to do that. And then I do a complete evaluation. Again, I will go through, if I take x-rays, I take them. But then on all adults, I have to check the gums. I do an oral cancer screening. I feel the neck and the throat. And I do a thorough oral cancer screening on adults and note that in my chart. And then if they do have periodontal problems, which is bone loss, I would have to refer them outside of here because I can only do basic cleanings. And then at the end of the appointment, I would attempt to schedule you with the dentist so that they can follow through with the complete exam and we would forward the x-rays to them.
Yes, so tell me more about your finding families a dental home and why we try to find a dental home, because that was really important.
Okay, well, first of all, I don't know if a lot of your clients or but childhood caries, which are cavities, is the most common chronic childhood disease. It's more common than childhood obesity. It's, I want to say, hang on a second, I should know that, like 4 times more common than childhood asthma, but people don't think of it as being a problem because it can be fixed, but it's still chronic. It's lifelong. You don't get a cavity the moment you're born. It has to do with your habits and somewhat with, the germs that are in your mouth, but mostly it's habits. So we do spend a lot of time, especially with pregnant women and early childhood, people that come like the 1 to 3 year olds explaining what they should and shouldn't be doing, which is another thing that I love about nurse family partnerships because they can explain that even before the baby's born too. They shouldn't be drinking juice from a sippy cup. They should only put water in a sippy cup. Things like that, how to brush their teeth, only to use a rice-sized piece of toothpaste until they're about 2 because little babies don't spit. So as long as it's just a small bit of toothpaste on their toothbrush, then they can go ahead and do that. So education is huge. Also, a third of kids between 2 and 5 already have cavities. And if we can catch them early, it would make such a difference long-term. And even in school, I can't recall how many, I had it up here, but there's millions of hours missed from school, not locally, but nationally, due to dental emergencies for children. That's how many schools they miss. Besides the pain, that affects their education if they're in pain. In the worst case scenario, of course, would be death, but that's rare. But that really is how Medicaid changed. The child's name was DeMonte Driver. He was in Maryland. His parents tried to get him into a dentist and couldn't find a dentist. They took him to the emergency room. The emergency room put him on antibiotics and sent him home. She still couldn't find someone to treat him. He went back, and after hundreds of thousands of dollars of hospitalization, he passed away. He was 12 from an abscessed tooth, which could have been pulled for $80. So it really was a problem. That was probably, I don't know, it was the early 10s, I believe, that it happened. So the Medicaid has definitely changed. More dentists are accepting Medicaid, but we still have limited numbers locally. It's just, they have too many patients. We don't have enough dentists per patient, which is why I can step in. And usually I refer, obviously, if they tell me the Medicaid provider that their child has, if they have Medicaid, I usually will refer to Community Health Net because they have a couple locations and we have a collaboration with them. But if there's someone locally that they want to see, I can obviously call that person and schedule appointments if they accept their provider. They have to accept the, if they're Gateway or UPMC for you, I would only send them to one of those providers. So.
Excellent. And we talked a little bit earlier about why having a dental home is so important, because a lot of our schools do have the dental van that come, and we're trying to have that safety net, but we still need to get into a dental home because why?
Well, first of all, if an emergency were to happen, if the child were to be riding a bike and hit his face on the pavement, or if he tripped and fell and his tooth on the side of a end table or coffee table, the dental home's not going to be, the dental van is not going to be available. So it's really important to have a dental home, someone to establish a relationship and maintain that relationship, hopefully throughout the child's life. And if they become comfortable, then they'll enjoy going more. If they can see that same person over and over again and not just have to go to a van. It really is, it's essential. That's my job. I want to try to find people a dental home so they have the security of knowing if something happens, I have someplace to go. Because it does happen. Unfortunately, accidents happen. Even in high school, in sports, not just high school, sporting events, kids will get hit in the mouth with a ball and break a tooth. It's really important to have that dental home.
Absolutely. So another one of my questions would be about if we could touch heart health and gum health.
Okay, it's not just heart health. Bacteria is what causes tooth decay. It causes gum disease. That bacteria can get into your bloodstream because, of course, it gets on your tooth and in between your tooth and your gums, and it gets absorbed into the bloodstream, especially if your teeth bleed when you brush. So it gets into the bloodstream and it can go to your heart and affect the heart. It's been shown to be proven to be a factor. It's not, I don't know if it's proven, but there's scientific evidence to indicate that it affects Alzheimer's patients. They found bacteria in their brain that normally is associated with the mouth. So that was kind of unusual. Definitely is correlated with diabetes. Both diabetes affects your oral health and bacteria in your mouth affects the diabetes. So it's like a two-way street in that case. There's so many things, arthritis, psoriasis. So it's not just the mouth. Up until years ago, just like the head was separate from the rest of your body. And now they realize that the head is really essential. The mouth in particular is essential to the overall health of your whole entire body. Like I said, even the Diamante driver's story. I mean, it was a toothache that caused his death. It was an abscess that caused his death. Is that common? Absolutely not. But if it were mine, it wouldn't matter how common it was. So it affects a lot more than people think it does. So that's also important.
Right. And so it's important to educate our families about that and let them know that there are these programs available to them. So that's why we have these wonderful Wednesdays with Wendy. What can they do if they want to get a hold of you on their own? Is there a phone number that you can
They would
give?
just have to call the health department main line, which is 451-670, I forget the 814-451-6700. Again, when they get to the receptionist, I don't know what number it is, just listen to it. If you want to talk to the receptionist, there'll be a button to press, and she will take down your name and number, and I will call you at my convenience. So usually within a day. It's not like I make you wait, but to schedule an appointment. And again, currently our we're only booking on Wednesdays and some Tuesday mornings. The appointments are relatively long, so that's important for people who have jobs to know. Again, it takes probably an hour even with a child, just because of the paperwork, not because of the work I do. If they're 1 or 2, it wouldn't take that long. It would maybe take a half an hour. But anybody older than that, where they actually sit in the chair, with babies, we do what's called a lap exam, where they actually stay in the parent or guardian's lap and face the guardian, and then they lay down with their head, like we're knee to knee, like you're against my knees, and we lay them down. They're a little bit less afraid then because they can see their parent or their guardian, and the guardian can hold their arms while they cry, and we look in their mouth. And they're allowed to cry. Most babies do cry. They don't like people in their mouth, but all we're doing is looking at their teeth and applying fluoride. Even if there's 1 tooth, we'll apply fluoride, because fluoride strengthens teeth, and we'll educate you on what you should and shouldn't be doing. So.
All very important things. Did I miss asking you anything important that we need to know?
There's so much you need to know. No, there's nothing really else you need to know. We do a lot more services than just in the office. I do go to some of the pre-K counts to do screenings at the pre-K counts. I also go to Head Start centers to do, actually I do dental cleanings for the Head Start, because we have a teledentistry grant at the Head Start for another year. So we actually go right, with parental permission, go right to the center and do the cleanings there and send the pictures that I take to a local dentist to review, and then they'll contact you to schedule an appointment if you choose to. I also have worked, again, although you deal with a younger group, I have worked prior to COVID, reaching out to senior citizen centers and doing presentations to them, because many of them are unaware of the consequences of poor oral health and how it relates to overall health. And that's really important. And honestly, teens, as far as vaping and smoking and use of drugs, sexually transmitted infections, all of that also can affect the mouth. So we do deal with that age group as well. But yeah, most people can call on their own. They don't have to be referred. Only because you asked the question before, if they are under the age of 18, they do have to have a parent, unless they're emancipated. So I can't see a child under the age of 18, regardless of if they're pregnant or not, without a parent being present. So I think that's important to know. I don't know exactly what you do, but I do think you need to know they do have to, or a guardian. It doesn't have to be a parent, but it has to be a guardian that has legal rights to sign these forms under the age of 18. Okay?
All right, well, thank you so much for doing Wonderful Wednesdays with Wendy. I appreciate you being here and telling us all about your program.
Thank you so much. It was a pleasure.
A pleasure having you. And that's it for another episode of W4, and we'll see you next time.
Thank you. Bye.